Hi everyone, thanks for listening to all my presentations. Today I'll proceed with the presentation on hepatitis E virus by limiting myself to treatment and prevention only. If you haven't listened to the first presentation on hepatitis E virus, please kindly do, because with that you'll be able to understand what I'll be talking about today more clearly. Treatment. Acute hepatitis E virus treatment will majorly include supportive measures because hepatitis E virus is expected to be self-limited. However, in the face of fulminant hepatic failure, we will embark on liver transplantation as the only way out of the problem. Ribavirin will be very helpful when it comes to hepatitis E virus infection treatment, but not welcome in pregnancy. It's good for others. We'll be making use of detection of hepatitis E virus RNA to tailor our treatment, and that could be done using both the stool and serum. Don't worry, in the next few minutes, you will understand more how we could make use of hepatitis E virus RNA to predict how we're going to treat anyone with hepatitis E virus infection. Now, Ribavirin. Ribavirin could be given for 12 weeks for organ transplant recipients and other group of people, but there will be further details shortly. If not on any immunosuppressive therapy, then you can give Ribavirin for 12 weeks. You recheck the hepatitis E virus RNA. If it is hepatitis E virus RNA positive, you can continue that Ribavirin for another 12 weeks. Then you recheck again the level of hepatitis E virus RNA. If it is positive, you continue for another 12 weeks. You recheck the level of hepatitis E virus RNA again. If this time around hepatitis E virus RNA is still positive, consider the situation to be treatment failure. Then you ask yourself, are there signs of worsening liver disease? But if RNA is absent, you have to recheck in the next 12 weeks. If after 12 weeks, hepatitis E virus RNA is still absent or negative, that is the end of the treatment. If it is positive, then consider that to be treatment failure. Now, if this same patient with hepatitis E virus infection is on immunosuppressive agents, the first thing to do is reduce the regimen of the immunosuppressants. Then find out, is this solid organ transplant? If the answer is yes, then give Ribavirin for the next 12 weeks. After that, you recheck for the level of hepatitis E virus RNA. Are we getting a positive result? If that is it, meaning there is hepatitis E virus RNA positivity, then we'll continue with Ribavirin for another 12 weeks. But if the outcome of hepatitis E virus RNA assay is pointing to negative result, not yet, Uhuru or Bravo, we have to come back in 12 weeks and recheck again. If after 12 weeks, the hepatitis E virus RNA is now positive, consider that to be treatment failure. But if we are lucky enough that after 12 weeks, we recheck and hepatitis E virus RNA level is still negative, then we are done. No more treatment. If the individual is on immunosuppressant but is not a solid organ transplant recipient, then we check hepatitis E virus RNA in 12 weeks after reducing the immunosuppressants. If the hepatitis E virus RNA comes out to be positive, then we'll give Ribavirin for 12 weeks. If it is negative, we are coming back to check again in the next 12 weeks. If this time around, after the checking is now negative, then no more treatment. But if after 12 weeks, hepatitis C virus RNA is now positive, after second Ribavirin, consider that to be treatment failure. Ribavirin for 12 weeks, then recheck. If positive, another Ribavirin for 12 weeks. Then we'll recheck again and it's positive, consider that to be treatment failure. But if after checking again, the hepatitis C virus RNA is negative, that is the end of the treatment. In case of treatment failure, you can use Sofosbuvir, but that will not completely clear the virus. Then what are we left with? We can make use of pegylated interferon alpha. But remember, there are horrible side effects. In fact, you can check my channel for pegylated interferon alpha that I've already published. You will get all the possible side effects right there, and can also lead to organ transplant rejection later on. So pegylated interferon is helpful, but it has its own troubles as well. Definitive treatment of treatment failure is always one thing: liver transplantation. Now, preventive measures. Remember, it has been said that prevention is better and cheaper than cure. And I've always added my own little on top of that, that even that prevention is better and cheaper than cure, it is only when the situation is even curable. Some situations could be prevented, but if they're not prevented and you get into trouble with them, you might not get a cure. For example, you can prevent HIV infection, but once you have acquired it, we've not found a cure yet. Prevention will become achievable only when we have known exactly how the disease we're trying to prevent is being transmitted. For example, in the case of hepatitis E virus, we will achieve the complete prevention if we familiarize ourselves with how hepatitis E virus is being transmitted. In this case, fecal-oral route transmission via contaminated food and contaminated water could be prevented easily, and we'll go over that in a bit. Zoonotic spread from animals to humans, particularly in genotypes 3 and 4, could also be blocked. Blood transfusion is possible, and that is why proper screening for hepatitis E virus and other infections will be done before that blood will be transfused. Vertical transmission is also known through pregnancy. Since we have known how this virus could be transmitted, then let's go through how we can prevent this disease. Travelers should be guided against unclean food and water. There should be no street vendors' food, no undercooked food or undercooked meat, no undercooked seafood, no raw vegetables, no raw meat should be consumed, no unpurified drink, no unpurified water. Pork must be cooked properly, please. No undercooked wild animals' meat. Don't play with rabbit, and don't eat its undercooked meat. Vaccination. Vaccination is available only in China. Immunoglobulin pre or post exposure is not yet proven to be very effective. And with that, I've come to the end of this short presentation as per the treatment and prevention of hepatitis E virus. Remember to share. You are free to leave comment, and remember to subscribe. I appreciate it.